So hey there, Indianapolis Healthplex members. It's another great day to be able to join and listen to educational opinions and educational things. Welcome to our podcast. I have Chris Lanning with me today. We are going to Chris, how are you today?
I'm doing great. How are you, Randall?
Good.
Awesome.
I think it's going to be a great time of necessarily discussing some of the things that what you do here at Indianapolis Healthplex and the ways that you can help members continue to meet their goals.
Yeah.
So I think there's no need to just keep prolonging this. Let's just dive into it.
Let's jump right into it.
Cool,
Absolutely.
Cool.
Yeah.
So Chris, I mean, just talk to me a little bit. What really is your position and what is it that you really do and bring to the table for Indianapolis Healthplex?
Yeah, so I'm the clinical integration coordinator. So what that means is I'm always reaching out and talking with different professionals, health professionals out in the community. So I talk with physicians, I talk with different cardiac rehab places, physical therapists, different providers that we have within the Indianapolis Healthplex. I'm really trying to reach out and bridge the gap for patients. So as we know, within our healthcare system, sometimes insurance plays a factor into everything. So sometimes people get cut off after so many sessions at their physical therapy clinic, and they still need a place to go and continue to work on strengthening and balance. So that's kind of what my role is here.
Cool. I mean, that's awesome. That's a great way to necessarily segment that from getting into being an injury and being able to come and do some physical therapy and continue that fitness mindset. So I know here at the Indianapolis Healthplex, we do have what we call HRA assessments. Can you talk a little about what is the HRA and what that really does for members?
Yeah, I really love our process behind the health risk assessment. So what we do is we sit down one-on-one for an hour, and by the end of the hour, I always tell our individuals, the clients that come in, that we'll get to know a lot about them, about their overall health. And that's why I love doing it, because we can find out their nutrition, their diet, their different eating habits, and their current exercise programming if they are doing one, and then make modifications to any of those areas if need be. So we first start out with just going through their past medical history, and that takes about 15 to 20 minutes. And then after that, we go through a CICA scan. And the CICA scan dives into a little bit more of the numbers behind what we're looking at as far as their health goes. So this will give us information on body mass index, hydration levels. We'll look at fat-free mass, fat mass, how much lean muscle mass you currently have, and then different kind of asymmetrical patterns that we may see on paper. So are you right-handed, predominantly strength on the right side? Or are you a little bit more stronger on the right side versus the left side when it comes to your legs, and how that plays into your overall fitness?
Cool. I mean, for someone like who's a former athlete that thinks they, know a lot about fitness, they played in high school, maybe played in college a little bit. Talk to me about how does that really affect the HRA, or how do you really assess those individuals?
Yeah, absolutely. So the second half of what we do with the individuals that come in, we go through what's called a functional movement screen. And this is a screen that's used across all populations really, but mainly the athletic population. Professional athletes and different teams use these with their athletes in order to gain better perspective as far as their core strength, their balance, if they have different strength weaknesses, that kind of stuff. It gets us a lot of good information. And this functional movement screen is comprised of 7 different movements. And so, like I said, by the end of it, we know a lot about your strength and your balance and your core abilities. So, and then we can base your programming off of that.
Awesome. I think that necessarily with that's a great addition that you get with your membership here with Indianapolis Healthplex. Is that something that is an additional cost, or is that something that's just included with necessarily when you come, or how does that kind of work?
Yeah, so the whole health risk assessment is completely free for members, so that's pretty cool. And like I said, it's a 1 hour just one-on-one session with myself or one of the other trainers here. And so, yeah, that's absolutely free for all of our members. So it's a really cool tool that we can get our members connected to programming a little bit easier in a safe way.
Sounds great. It's just, what have you seen is really the major, and I know you talked about what the screening really does, but what do you see as like the main benefit of once you get the numbers, how can you necessarily take that and what does that really mean?
Yeah, so I think a lot of clients that we work with, they're surprised sometimes after the health risk assessment, especially the athletes that we worked with, because they may think that they have really good balance, really good agility, good strength, good power, but then you go through some of the tests, and it's kind of an eye-opening experience for a lot of the athletes in particular that I work with. Because they want to increase their speed or agility on the playing field, but then you go through this functional movement screen and you see a lot of core weaknesses, or they have a lot of upper body or lower body weaknesses, and you want to make sure that you safely address those first so that you're not setting that athlete up for an injury. So a lot of the athletes that I work with, I start very basic and work on core exercises with them, just like I would with any other client that I work with. And we start from the very basic foundational level. But you want to build proximal to distal strengthening with people, and that's the way that I program. If we build proximal strengthening, core strengthening, hip strengthening, and start there. Same thing with the upper body. If we focus on more scapular strengthening in between the shoulder blades and then kind of work our way out, that usually works pretty well for the clients that I work with.
Awesome. I think that's great. I mean, I don't know why you wouldn't. I guess from that, is there anything personally that you've seen somebody has come in and taken an HRA and you've gotten the results and you've been able to put them through some personal training or different fitness exercises they can do? Is there anything that necessarily you've seen that like, wow, they've come so far? Like, what is it about Indianapolis HealthPlex personal trainers that have really taken that and necessarily taken members to the next level?
Yeah, we take a lot of pride in our exercise programming here, and that's something that makes us stand out and makes us very unique as a facility. And so all of our trainers are well educated. They have degrees and certifications as well. But the big thing that I tend to see with the clients that I work with is their ability to see pretty quick results. And with some individuals, it's not so quick, but it's always good to take it week by week and understand that, okay, 3 weeks ago, you weren't able to stand on one leg. Today, we're now able to do that. Or I had a client the other day who told me, I wasn't able to get on my mountain bike for the past year because he was coming off of a stroke and still trying to regain strength. And so we practiced a lot of hip strengthening with this individual. And he told me this past weekend that he was finally able to ride his mountain bike for the first time in over a year.
That's awesome.
And that's so gratifying for me as a trainer to hear those kinds of stories and to be on that journey with our clients is really important.
Awesome. Now, I mean, we've gotten a little bit into the podcast a little bit, and I'm sure some people are really kind of wondering, who is this guy just kind of talking and knows so much about this? Can you just tell our viewers about where you come from, your background a little bit, where you grew up, where you went to school? Just tell us a little about Chris.
Yeah, absolutely. So I grew up here in Indianapolis. This is my hometown. I grew up on the southeast side of Indy in Franklin Township area. Went to Franklin Central High School. Played tennis there, continued playing as an athlete at the University of Indianapolis for my undergrad, and I did exercise science there. Enjoyed my experience, have always been around fitness as an athlete, and just have always been kind of a nerd with it a little bit. I always love research and just looking and talking with different professionals within the field. And then after that, I went on and got my doctorate in physical therapy from Trine University. And that really helped educate and allow me to get a full grasp of what it means to work with a client holistically from different angles. And to be creative with their exercise programming. You know, a lot of clients that we talk with that may be older, they're not looking to do powerlifting necessarily, but they've got other goals, whether that be just general strength so that they prevent falls, or balance training. And so that's where my education kind of has fallen through the years. But I've had over 6 years of experience working in sports medicine, sports performance. I've been in the hospital settings. I've dealt with the chronic side of injuries before and pain. But I love my position here at the Indianapolis Health Plex because I get to be proactive with clients' health, and that's why I love my job so much.
Awesome. Well, Chris, I think it's been a great experience. I mean, as we're wrapping up here, is there anything that necessarily you would say? Obviously, we know you're not just some random guy off the street. You really know your stuff about these HRAs and your physical training and sports movement. Is there anything that you would recommend or necessarily say to any viewers who haven't taken an HRA or seek a scan? What is it necessarily you would say to those members?
Yeah, I would try to get those scheduled. So there's a way, and we'll put this in the link too, of ways that you can get a hold of us here at the Indianapolis Health Plex. My direct phone number, my email. That way we can get something set up with you, because the sooner that you get one of those health risk assessments set up, the quicker that we can reach your goals. And that's the most important thing. And I'm really excited if anyone's out there, they're watching this video, and they just want to take that next step, and they've been putting this off for a while. You know, maybe they didn't start right in January when those New Year resolutions start up, but there's still time, and that's the beauty of this, is that we can talk about all aspects of your life when it comes to nutrition, like I mentioned earlier, different ways that we can talk about, your fitness goals, and different specific, maybe work-related goals that you might have to be able to do your work job a little bit easier. So I would highly recommend that anyone just reach out and contact us directly here, and I'd be more than happy to talk with those individuals on the phone and talk about more of their goals and how we can move them along to reach those.
Cool. Well, Chris, it's been great. It's been a great time talking with you about these, and I look forward to talking with you a little bit more about some other topics. So we just want to thank everybody for listening and paying attention to our podcasts and our videos. For more, check us out on YouTube, check us out on Spotify, check us out on our social media pages for updates on not just our podcast, but things going on in the gym and how you can be a part if you're not already a part of our Indianapolis Health Plex family. So thanks for being a part, and we look forward to seeing you next time.
Thanks, guys.